You're juggling it all: work, family, decisions, expectations, 6 hats, maybe more every single day. But behind the scenes, your body is running on stress, and stress left unchecked will lead to illness. I'm Dr. Shami, an integrative family doctor, and this is 6 Hats, the podcast that helps you understand what stress is doing to your body and what you can do about it now. Hello, everyone. Welcome back to the 6 Hats podcast. And in today's episode, I speak with integrative gynaecologist Dr. Shamitha Kathurusinghe, who is also called Dr. Shami. So it's going to be confusing in today's podcast. And we're going to talk about the whole person approach to women's health. We're going to unpack how nutrition, lifestyle can drive conditions like heavy, painful periods and endometriosis, and why healing starts well before surgery. So welcome, Dr. Shami.
Thank you so much, Shami, for the lovely invitation. And it's just crazy to understand how many things we've got in common.
Exactly.
We share the same birthday month.
Absolutely. Oh my God. And today's conversation, you're going to hear a lot of Shami. So absolutely. So I'm going to get started. I remember when I saw one of your letters from a patient, I go, wow, I was blown away. I couldn't believe I found a gynecologist that literally is holistic and actually talks about nutrition and lifestyle. And I'm talking about 25 years in practice. It's phenomenal. So I was super excited. I got in touch and you're like my go-to gynecologist now. So I'm curious, what led you into integrating nutrition and lifestyle? Because as you know, this is not common. This is not a common practice.
Yeah, so I understand that, but I'm always sort of shocked that it isn't common practice. And I was just really reflecting on, because this is something I repeatedly hear from colleagues and health partners that I work with going, oh my God, Shami, you're so different in the way you approach patient care, especially in that pelvic pain space. And I was really thinking back as to what happened to me? What was it that happened? And I think it was really because I must say I was really fortunate that with my training, I got a training opportunity at the Royal Women's Hospital in Melbourne. It's one of the premier women's health hospital. We look after everything and anything to do with women's health across obstetrics and gynae. And in that, though, regardless of how amazing my training was, when it came to sort of managing key gynecological health conditions, I felt like there was just something always missing. And I started to notice that, especially in the emergency department, when in acute care we get gynae patients with pain and bleeding and all these things coming up, you just feel like you just do a certain amount of medical management. And beyond that, there's something missing. And when you really take time to sort of listen to these patients, especially in the clinic setting, and I started while I was in the public clinic, I started recruiting or somehow attracting complex pain patients, complex health condition patients. And I think what it was I just took time to actually understand what was going with the person first. And then when I understood what was happening with that person, with the health condition that they're experiencing, you could start to align the dots together and go, oh, this all makes sense. And when I went to Oxford, again, really fortunate to get to be chosen to be the minimal access surgery fellow for Oxford in endometriosis minimal access surgery. But what I'm and I'm embarrassed to say this in the sense I love the operating, don't get me wrong, but what really gave me joy was Persistent Pelvic Pain Clinic. They ran a multidisciplinary team clinic, and I had lots of time to actually go to the clinic and sit down with the physiotherapist, with the psychologist, and even with these amazing gynecologists that run this clinic, and actually look at how we can have a holistic approach to management of gynecological health conditions. And then it was curious for me to see, because we would do so much research around this, that all these patients got pre-surgery questionnaires and they do post-surgery questionnaires, and then we'd follow them up for about 2 years. The patients that actually had really good preoperative optimization, not just from a medical point of view, but just from a holistic point of view, they felt that their pain was validated, they considered their lifestyle optimization, all that stuff, they did better surgically and overall. And they were much more in control of their health. And even say from a pain perspective, when they had a pain flare, they were more likely to come out of that pain flare than someone else that hasn't got that toolkit. And that really, again, made me go, you know what? This is what we're missing. And then when I came back in 2019, I founded the first privately funded endometriosis and adenomyosis private clinic in Melbourne. I no longer, unfortunately, run that clinic, but again, we had that opportunity to bring all these healthcare practices together, have MDT meetings, and look at the patient from a holistic point of view and put holistic treatment plans in. And it was just fascinating. When I audited, we looked up to about 80 patients there. only 1 in 5 actually end up in surgical management. The rest, we did.
Wow.
I know. So that really gave me joy. And even if they did have surgery, we were able to kind of keep our patients well for longer before they needed surgery. So these are things, I think, my own experiences that I've sort of seen in my patients that made me think this has to be the center of what we do. I pride myself at providing excellent surgery for my patients, but I'm always about surgery is just one part of that toolkit. You've got to bring everything together so that the patient can get the best outcome from surgery.
That is amazing. I'm so inspired and it's so refreshing. And thank God we've moved from just surgery or hormones as a solution for gynecological conditions. I want to dive deeper. So what did you learn when it comes to diet and lifestyle? I'm curious about what happened in the UK and what you saw in your patients when it comes to what we commonly see in general practice, heavy, painful periods, and especially endometriosis. Yeah.
Yeah, so look, we know, and research tells us, if nothing else, that diet, inflammation, and lifestyle factors, they significantly influence common gynecological health conditions such as heavy and painful periods, and of course, endometriosis. We know that the lifestyle changes that are happening, along with the inflammatory things that we might be doing, are all contributing to either increasing symptoms or worsening of quality of life, or in some instances we think may lead to even turning on genes for a person to develop a certain condition. I think I think historically we've been a bit behind in terms of that sort of understanding about gynecological health conditions and the link between diet and inflammation, etc. If we look at endometriosis, and I love the fact that we're finally getting so much advocacy, research, education there, and I must say it's the patients that have been driving this, which is fantastic. We know that endometriosis is a chronic inflammatory condition. 5 to 10% of women or people of reproductive age have this condition, and a lot of them suffer from pain, right? And we know that oxidative stress, it plays a significant role in the pathogenesis mechanism of endometriosis. And we know that this is a hormonally driven condition. Now, we know that there's no cure for endometriosis, well, not yet, right? But we know there's lots of common treatments that patients themselves or us clinicians will talk about to reduce symptoms. If you look at patient surveys, and there's a lovely survey done about what do patients do as management strategy for such a condition like endometriosis, and diet is like the 4th biggest thing. And we see that, right? We see the impact of changing one's diet, and it's not rocket science. We're talking about improving things like looking at what you're actually putting into your mouth, thinking about eating a bit more clean, reducing processed food, reducing processed sugars. All these things go a long way with respect to symptom improvement. And these survey studies have shown, in particular with endometriosis, that dietary changes actually root to improvement in overall symptoms. There's been other high-quality research looking at dietary interventions like FODMAP diet, or we call a low or anti-inflammatory diet. Now, I'm always weary about we don't want restrictive eating. We don't want to reduce food groups. We want to sort of look at how can we, under professional guidance, like with the dietitian, how can you look at having a colourful, balanced diet overall. And that's what's important. But it's nice to see the association of where when we can reduce inflammation can improve the outcomes. Let's talk about exercise. We know exercise is good for everything and anything, including gynecological health conditions. We can talk about PCOS, we can talk about heavy menstrual bleeding, adenomyosis, or endometriosis. There's research around the value of exercise in reducing symptoms, and especially for reduction of pain. The other thing is that I am a fan of nutrition supplementation in certain instances, and we know that there is some research around certain supplementations. And in the right patient cohort, I'm the first one to say, have you tried this? Can we do this? Because I always think if you give a patient a tool or strategy, it might not work for everyone, but for that patient that it works, it's just that another positive element in their life. They're going, I've got this, I can use this, I come prepared. And it's just another tool in that, kit that they can have.
Amazing, amazing. I loved what you mentioned about oxidative stress and inflammation and simple dietary changes. And it really is interesting. It could be insulin resistance that leads to insulin resistance. And I was reading somewhere, wow, the rates of insulin resistance has skyrocketed. And often it's always surprised me. So even the slim, young female who I never expected to be insulin resistant is insulin resistant. And hence why I'm checking in actually all my patients now, especially if it's hormonal, but also anxiety, brain fog, tiredness that will present. And it does result in oxidative stress. And it's so interesting how, just to have a conversation about in today's world, we're just over consuming in terms of food, we're snacking, we're stress eating, emotional eating. And if you look at different work environments, just to give you an example, like I see many teachers and nurses and people in healthcare, let's just look around. It's surrounded by chocolate and biscuits and, all these unhealthy snacks. And especially teaching and nursing is very female dominated as well. And it's just so interesting to look at your environment and what habits you've taken on as a result of your environment, because we're not thinking, we're stressed, we're busy, perhaps not sleeping.
Hungry,
Absolutely.
Here we go down, and you've not even thought through it. And if you think about it, you haven't actually had any fluids to drink the whole day. And it really is about just going back to the basics, isn't it? Good nutrition, movement, hydration, sleep, free time. It is no one leaves my consultation without us having a conversation about those things, because this is what's happening to us, isn't it? We're just busy, 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 and it's actually impacting on our health.
Absolutely. And often it's just the awareness, because often, when you come and see yourself or myself and you go, wow, I didn't realize I was doing that. And it's just the simple awareness, simple tweaks of, starting the morning with a good protein, which ends up filling you up. So then you end up not really wanting that sugary snack, even though it's right in front of you. And it's those simple changes, like what you've mentioned. And it's what the message I'm wanting to get across is not hard at all, even though it may feel hard because you're stressed, overworked, not sleeping. But if you just take one tiny step, that really works towards reducing inflammation.
And I do think our patients actually like that we are actually encouraging them to make those positive steps. Because even for me, if I'm ever the patient, when my GP or my healthcare provider says, "Hey, Shami, have you thought about this and this and stuff?" And I told you this brief example about the dermatologist said, it's nothing like, busy women and their protein intake. And I was like, that sounds like me.
Yeah.
Right. And then I take away from that going, okay, Shami, you need to think about your protein intake, because exactly what your dermatologist said. And I think they're positive things. And then we're giving, easy but more important, simple things that our patients can actually follow through with.
Amazing, amazing. And I love the fact that you've seen those results, because it's almost like hard to believe. Like, in the medical model, it's almost like hormones and surgery. And the fact that you've actually seen diet and lifestyle make an impact. Are there any stories to sort of share where you've seen patients say, I have less pain, my periods are better?
Absolutely. It's very commonplace. And often when I do see some of our patients, I remember this example where I saw a particular patient and she was just so unwell, repeated asthma flare-ups, in terrible pain, very stressed, working 2 jobs, etc. at the moment. And just her life was just falling apart. And I was just like, let's look at this. I understand that you're here for your gynae issue and pelvic pain, but I think we've got to tackle all of these things. We've got to get your flare-ups under control. We've got to get you can't work, working 2 jobs is not sustainable. We've got to try and, get some movement back in. She can't exercise because the asthma flares up. Therefore, she's at home comfort eating. Therefore, her pain's worse there. And then she goes to work in pain. So it's just this, spiraling, tragedy that's unfolding in front of us. And we just went, you know what, you're at crisis point. We've got to kind of work back. And it's just really amazing because we put these strategies in and I saw her 6 months later. And before I saw her, she'd put a review of her life story about like how amazing her life had changed. And I was just so happy because I'm the first one to say you need surgery when you need surgery. I'm the first one to say, you know what, there is a role for hormones here. We need to consider this. But I don't mean do that one instead of the other. I'm talking about let's incorporate everything together. And when I see a lot of patients that have had second and third opinions, and they're like, I don't want to do hormones, Shami. And I'm like, I'm hearing you. I hear you. I understand. I know. Let's look down all this. And then what I say is, why don't we work together? Let's try all the non-hormonal, all the lifestyle modifications. Let's try everything and anything. If we can get you half of the way, 50%, and your quality of life is already better, I reckon your body's then ready and it's in a stage to try something else. And then let's introduce something like a hormonal medication at a lower dose. And if you don't like it, we stop. It's your body, you're in control, you get to decide. And just giving that, that little bit of ability for the patient to take control and know that that's okay. And that stepping stone, that's how I think it works best. So we're not, we're just trying to incorporate everything together.
I love that, the collaborative care and support, which kind of leads me on to my next question. So what makes your care different from traditional gynecology? And you can elaborate on your approach to patient preparation prior to surgery, which I just found so refreshing.
Oh, thank you. Look, I think this is, again, I think we've just sort of touched on it, but I think traditionally gynecological approach to care has not, it's left behind, especially from how we provide care and even from a research point of view. And I think there's complex factors around that, but I'm really glad that both in Australia and globally, we've got these amazing leaders that are really pushing through, and change is coming. We can feel the change, and, collaborative holistic care is now sort of, or patients-centered care is now becoming the forefront of sort of gynecological care. Yes, we've got a long way to go. For me, there's a few things. I'm always about listening to my patient. So I really take on the time, because I think a lot of research says that in gynecological health, often patients have seen 7 or 8 health professionals before they kind of get the help they deserve. For conditions like endometriosis, they may be suffering anywhere between 8 to 12 years before they get a diagnosis. And women often feel that they do say, I've got terrible period pain. I haven't been to, I've missed 2 days of school since I was in year 7, or I've got heavy bleeding, but it just seems like it's been unheard. And then they tackle everything else except what's actually going on. So for me, it's all about listening to the patient, asking what's important for them and what are their quality of life goals, and let's drive that as opposed to what any of my agenda may be. So it's all about what they want to do, understanding what works well, what they're comfortable doing, and also understanding what they don't want to do. So if they don't want to try hormones, or they don't want to have surgery, or they're wrong there, I've listened to that. I'm also very much about examining the patient in a it's now called trauma-informed manner, but, I've always thought about that, really about, the impact of the way we communicate, the way we look, the way we touch a patient, how that can traumatize a patient. In fact, today I met a patient for a second opinion that's seen someone else and come across, and she was reflecting on the fact that she's decided to change care because the examination point was so traumatic that it actually flared up all the hard work that had happened, all the hard work, all the gains that she had with her pelvic floor physiotherapist. And it's crazy that simple clinical interaction between a patient and a clinician can kind of be such a negative experience for some patients. So I'm always very mindful about that. I've also another area where I've really looked into is called neuropelviology. It's where we bring pelvic pain, the nervous system, all together, and understanding there's just more than just the organs that are contributing to pain. I also look at the muscle components that add to pain. And then with my examination process, I look for the reasons why the patient can be in pain or have other certain health concerns. And then we tailor-make their treatment plan accordingly. And as part of, if they're going through that surgical journey, preoperative optimization, which I recently spoke about at the Australian Gynecological Endoscopic Surgery Society meeting, I talk about the pillars of optimizing medical optimization, lifestyle optimization, diet, sleep, and then looking at the patient's preparedness for surgery, whether they've had enough information, where is their preoperative anxiety at, do they understand the procedure, what are their fears, and how can I best navigate them? I do simple things like holding my patient's hand, playing cool upbeat music, or asking them what they want to hear before going to surgery. This morning I did a hysterectomy and the patient was good. She's like, oh my God, I love this upbeat song. I said, we can change it. Like, no, I love it. I love that you're upbeat, it's 8 a.m. in the morning. But I think all of these things matter. And when I've operated on a patient, I'll be sitting at the desk and they'll be in recovery, and I'm keeping an eye on the patient in recovery because I don't want my patient to wake up and be and have unmanaged pain or feel like they're all alone. I'd always go in and check in. And I think all of these things are essential to providing excellent gynecological and surgical care.
Oh my God, Shami, that's amazing. Because I'm just thinking about, 50, 60 years ago, how the importance of good nursing is in healing. And I loved how you say, just holding a hand, that kindness, the care actually is so good on the nervous system, and it supports all the healing process. I can't think of studies off the top of my head, but there's so many that's related to really good aftercare, obviously pre-surgery care as well, and how it improves outcomes as well.
Exactly right. That's exactly right. We know that an anxious patient going to sleep off an anesthetic is actually going to do worse off in recovery and worse off post-operative. It has an impact on their, post-operative outcomes. Why, if we've got the ability to change that for that patient, why not? Why not make the time? I think it's important.
Amazing, amazing, Sherry. And so this is my last question. So for many women who feel unheard or told their only option is medication or surgery, what advice do you have for them?
Really good question, Shani. So I was thinking about that. Look, unfortunately, when it comes to a lot of gynecological concerns, often people have suffered symptoms for many months or years before they kind of go and say, "Oh, I need to get, I need to try and seek some help." So a lot of patients have waited years for, management of a health condition. So I'm always of the opinion, if you're feeling unheard or you feel that your healthcare provider is not the right for you, then I think you really need to take the time to reflect on why and ask yourself what are you seeking? And then consider the next step to kind of then provide yourself with value aligned care. A silly example would be like, when you go to a takeaway store and you've had bad takeaway, just go there. Similar thing that, take the time to actually find the health team that actually aligns with you. And not every person will align with the same healthcare provider. We're not all going to impress or make every patient happy. I've got a fair number of probably patients that have been probably seen me and gone, no, I don't like Shami. And that's fine. That's a good thing to recognize if you're not aligned. I actually urge any patient seeking healthcare, just don't pushed into rushing into surgery out of fear, or that it's the only option, or it needs to happen immediately because there's this time critical thing going on. Of course, there are acute presentations, don't get me wrong, such as, appendicitis or an ectopic pregnancy or ovarian torsion, etc. Of course, that is acute emergent situation. But outside of that, with chronic health conditions, majority of the gynecological covenant, you need to take the time to understand your options. And patients also, it's also important to know that if you're waiting to see a really good specialist and they've got a bit of a wait time, often an indicator of how good they might be in their job because they're actually probably really good and very popular because how good they are. So don't rush into trying to find the quickest appointment, quickest surgery, etc. And especially we've got to be, and I'm talking about endometriosis here. We know that research says when it comes to conditions like endometriosis and persistent pelvic pain, your first surgery is actually your best chance of symptom improvement and getting the best outcome. So it's really important that when you do see a gynecologist, or especially if you're heading down that surgery track, or it's a particular health condition, we all have our areas of interest. And it's nice to know what your gynecologist's area of interest is. Some gynecologists are experts in menopause care or perimenopause. Some are experts in vulvar care. Some are experts in advanced endometriosis surgery or laparoscopic surgery. It's good to know what their area of interest is. I always say, and I love it, most of my patients come with a list, and I love a good list. Write a list of what your concerns are. And when it comes to say medical management, like pain relief or hormones, ask questions. Ask your doctor to give you some written information about what was discussed. Ask for some, it's the world of the internet, right? Send some links, get some information, write everything down and go away and think about your options before you make a decision. I will often go with my patients and say, these are the options. I'm going to do some scripts for A, B, C. I don't want you to take any. I'm going to send you this information and then I'll let you decide what you want to start off with so that patients have that ability to kind of go away and make that decision that's right for them. I always welcome after a consultation, I often get emails saying, I forgot to ask Dr. Shani this, or I was just wondering if I could double check. actually don't mind those questions because it's telling me that the patient's gone away from that consultation and thought about something and just wants further clarification. It's good to clarify. Now, let's talk about surgery. In the world of gynecology, when we talk about surgery, it's important to ask your surgeon that questions that matter to you. You need to know what procedure you're having. What are the risks of the procedure? What is the actual realistic recovery? What if things don't go to plan? What are the complications that can happen? Can my hospital stay be extended? What will happen in terms of if you've got work or childcare responsibilities? You need to ask these questions. It's okay to get reassurance from your surgeon about their expertise too. I think it's really hard because for a patient to kind of know, even me as a clinician, I wouldn't be, if I was going to see, say, a plastic surgeon, I would really find it really difficult to understand who is good at or what their level of expertise is. So I think it's same applies to our patients that come to see us. It's important to ask about their specific training. Are they a high volume surgeon versus a low volume surgeon? It's important for you to understand that because we know, again, research says if you get operated by a high volume surgeon, then your surgical outcomes are likely going to be better than a low volume surgeon. It's also really good also during this time, and I speak to my patients about this, is like it's important to be aware of your own misconceptions and biases because we've got all these algorithms sending us, we've got TikTok, we've got ChatGPT, we've got all the AI kind of and Dr. Google. So it's a minefield out there. So I ask my patients, just keep an open mind. Yes, you may have heard that this is bad for you, but let's have a chat about why or why not so that we're really making sure that you as the patient actually get the facts from an expert that is keeping their information up to date, as opposed to going to ChatGPT, who will pull up all the resources and say, this is bad for you or this is good for you. I also recommend often to the patient to say, go back to your primary healthcare provider or the allied health profession that's referred you. Go with them and tell them about the consultation and have a chat to them about it and then make a collaborative decision about what's right for your care. But that's what I would sort of say to patients. Don't panic. Don't feel like you have no options. There's time.
Amazing advice, absolutely amazing advice. And I'm thinking, wow, so many can really benefit. Just slowing down, pausing,
Yes.
okay to ask questions. I don't remember if you recall, like 20 years ago, many people are scared of consultants and specialists.
Absolutely. You wouldn't ask, you just do what someone said, right?
Yeah, you never questioned the doctor. Obviously, things have changed completely. And it's time, it's giving the green light to actually take ownership of your health and be part of that decision making. Thank you so much for your time today, Dr. Shami. Where can patients find you?
Well, my private rooms are in Melbourne East. We're a part of Clinton Avenue Centre for Specialist Care. We house a lot of specialists here and we've got lots of collaborative care happening. Yeah, so you can reach out to me and I'm on the socials, of course, Instagram and LinkedIn and Facebook.
Amazing. I'll put all the links in our show notes. Thank you again.
Thank you so much for having me, Dr. Shami.
Thanks for listening to Six Hats, where it's all about progress, not perfection. If this episode spoke to you, don't wait, hit follow now, leave a quick review, and share it with someone who needs to hear it. Want to take your next step today? Download my ebook. The link is waiting in the show notes. And remember, this is general advice only. Always speak to your practitioner for anything medical. See you next time.